or Chentang two-cure decoction. In TCM, phlegm is viewed as a root cause of many ailments, summed up in the saying, of 10 diseases, 9 are caused by phlegm. Phlegm in this context is not merely something you cough up when you have a cold. It is a broader concept that refers to pathological substances blocking the normal functioning of the body. Phlegm causes different symptoms based on its location in the body. In the lungs, it leads to coughing; in the head, dizziness or headaches; in the ears, hearing issues; and in the eyes, visual impairments. In the nose, it causes a runny nose; in the throat, a hoarse voice. Phlegm in the chest causes tightness; in the stomach leads to abdominal pain or diarrhea; and in the limbs or back, it causes numbness, pain, or poor circulation. The TCM theory states spleen deficiency produces dampness. Stagnated dampness turns into phlegm. In other words, when the spleen is weakened, dampness occurs, and if the dampness persists, it turns into phlegm. This concept is similar to the ancient Greek medical notion of rheuma, which refers to any watery discharge that obstructs the normal functioning of the body. The representative TCM used to treat phlegm is Banksia, and the prescription is Tang, and the most effective acupuncture point is ST40. These are used for phlegm regardless of where the phlegm is located, substantial or non-substantial. Tang treats phlegm like unclogging a drain. It dissolves the blockage, moves it away, and flushes it out, resembling the process of using chemicals, plunging, and pouring hot water in a pipe. Banksia, the primary ingredient, acts as the chemical dissolving the blockage. It's the most effective herb for resolving and transforming phlegm. Chenpi, the second ingredient, serves as the plunger, promoting the movement of qi and pushing the phlegm away. Fueling, the third component, flushes out the remnants of the clog through urination, much like hot water used to clean a pipe. This combination of herbs within the Tang formula, therefore, provides a comprehensive treatment for conditions related to phlegm in the body. Banksia, Chinese green dragon, tackles phlegm. Banksia, also known as crow dipper, is a plant native to China, Japan, and Korea. It also grows as an invasive weed in parts of Europe and North America. The leaves are trifoliate, and the flowers have a spathe and spadix form, typical of plants in the family Araceae, known as Tian Xing. This plant is commonly used in TCM for treating phlegm. Its Chinese name, Banksia, is derived from the fact that the plant sprouts and flowers around midsummer in June. The plant has a unique appearance, with peculiar leaves and flowers. Its English common name is green dragon, and its flower resembles a rising dragon or snake. Banksia has a warm temperature and an acrid taste. It enters the spleen, stomach, and lung channels, and its typical dosage is 5 to 12 G. Its actions include drying dampness and transforming phlegm, harmonizing the stomach and relieving vomiting, and dispersing stagnation and dissipating nodules. However, it is contraindicated for dry cough from yin deficiency, sore throat from fire excess, and bleeding. Unprocessed or overdose of Banksia can cause dry mouth, numbness of the tongue, and gastric discomfort. Banksia is used in several TCM formulas such as Tang, Banksia Tang, Banksia Haopotang, or Banksia Baiju Tian Tang. Since April 2004, Banksia has been banned in the U.S. because it contains chemicals called ephedrine alkaloids, which might cause serious side effects such as heart attack, stroke, or seizures. The ban does not apply to traditional Asian medicines containing this ingredient. These products use Banksia tuber, which has been processed to remove sharp crystals that can irritate the mouth, throat, and gut. Recent research has shown that Banksia pinellia tornata contains an average of 1.65 micrograms per G of ephedrine. Even if the maximum daily dosage of 3 to 9 G from the Chinese pharmacopoeia is taken, it only equates to 0.01485 mg, which is far below the World Anti-Doping Agency's urinary ephedrine detection limit of 10 micrograms per milliliter. In one study, it was reported that 2/3 of samples exceeded the 10 micrograms per milliliter limit when 12 milligrams of ephedrine was ingested. The 0.01485 milligrams is only 1/828th of 12 milligrams. Furthermore, excessive use of Banksia can cause hepatotoxicity and gastrointestinal toxicity, so it is not used in large quantities in clinical practice. In China, Japan, and Taiwan, TCM formulas containing Banksia, such as Banksia Hupotang and Banksia Shashentang, are widely used, but they do not prohibit its usage. In TCM, Banksia is processed with ginger to reduce toxicity. Below is the picture of processed Banksia, which is often called Jiang Banksia. Jishi and Jike. In South Korea, Jishi comes from the immature fruits of Ponchirus trifoliata, while Jike comes from Citrus aurantium, Citrus natsudaidai, or their varieties. In China, both are from the same plant, with Jike being the ripe fruit of Zishi. Japan does not officially recognize Jike.